everyone, we're taking off for the week of Thanksgiving, but we do have an unreleased gem from the vault. This is actually the first episode we recorded before the podcast even had a name. We had on Kevin Fyock and Kevin Smith, both from Aon, and they're great. Right on the cutting edge of everything from AI integration to medical wearables, and thinking very hard about employer-side innovation. I was still trying to figure out how to do a podcast, but they're smart guys and friends, so the conversation ended up being fantastic anyway. Enjoy, and we'll see you back next week.
The affordability crisis is real. How are we going to manage this moving forward?
The compounding effect of healthcare starts to take away from the salary picture. You only have so many dollars to spend and something's got to give.
Everything else in the world, higher cost means higher quality. And what we're really realizing here is that those two things are not necessarily one and the same.
Technology, AI, predictive analytics, those are readily available now.
The landscape of employee benefits is evolving faster than ever. Rising costs, shifting regulations, and increasing consumer expectations are forcing employers to rethink their strategies. I'm Kirk, Senior Vice President of Strategic Alliances at Garner Health, and today we're exploring the biggest trends in employee benefits for 2025. I'm excited to introduce Kevin Fyock and Kevin Smith. Thrilled to have both of the Aon Kevins from the Philadelphia area on today's podcast.
I'd like to maybe copyright the Kevins. Thanks so much for having us on. Thrilled to be here, Kirk. My name's Kevin Fyock. I lead innovation for Aon Health Solutions. Excited to talk about sort of what we've learned in talking with our clients, what sort of we've done research in the market on. Again, thanks for having us. This should be a really fun conversation.
So I'm Kevin Smith. I'm Aon's U.S. Health large market leader. So really happy to be part of this discussion with you and the Garner team.
Really want to start the conversation today really around the past. So let's take a step back. Let's talk about the big question. Why are we still discussing cost and quality in U.S. healthcare after decades of supposed solutions? If we've had all the answers, why does this conversation keep coming up? Why are the Kevins and Kirk together today? What are the main reasons that the U.S. healthcare system is still struggling to make real progress on cost and quality?
I'd first say that those topics, while they're inextricably linked, are two different topics, right? Sort of managing cost, especially in a very high cost environment. We're projecting upwards of 10% in the coming years from a healthcare trend perspective. But that's very different than quality and how we get people towards quality providers, how we get them to the next best action. In my opinion, Kirk, so much of it is the fragmented system that we find ourselves in. You know, in my role from an innovation perspective, I see so much cool stuff that's happened in the past several years and stuff on the horizon. But even with all of that innovation, it's still fragmented. It's still disparate. And I think members at the end of the day still struggle with where they go to access care. I spend a lot of time brainstorming around how the benefits world has a lot of similarity to the consumer world and what we do sort of outside the healthcare ecosystem. But it's also very different. The way that we're consuming healthcare is very different. And when you're talking about this macro topic of cost and especially quality, the way people consume healthcare is sometimes a bit counterintuitive. And I think old habits die hard, and you have people that are still turning to search engines to find doctors and still asking friends for where they should go see a specialist as opposed to focusing on real quality data, which is available. But I think it's difficult for members to understand how to access it.
No, I think that's fair. And, you know, I think, hey, everything else in the world, higher cost means higher quality. And I think what we're really realizing here is that those two things are not necessarily one and the same as it relates to healthcare. So that's difficult for the average consumer of healthcare to really understand. They typically think, hey, if I want to have really good quality care, I'm going to pay the most for that. And hey, if I go somewhere and it's not as expensive, or in some cases it's free, like, what am I going to get for free as it relates to the health and the outcomes of myself, or even for my family as well, my spouse or my children. So, you know, there's just been this thought over the last several years, this concept, value-based care. How has the shift to value-based care changed things as it relates to cost and quality? And again, why hasn't it completely fixed the issues that we're here talking about today?
Yes, it's a great question. It's timely. So there's an evaluation being done by many employers of value-based care. I think there's a few reasons why it has not been as widely adopted as maybe, some would have hoped. I think the first piece of it is, we are still dealing with a health crisis in the country where people are generally not as healthy. And we are seeing prevalence of conditions like cancer and like mental health, heart conditions that are still on the rise, despite some of the programs that have been put in place to manage it. So people are less and less and less healthy, which is driving this spike in overall cost that you mentioned earlier. There's a second piece to this, which is in some cases, people don't have a primary care physician that is coordinating the care for them. There might be some value-based care options available to that particular member, but they either don't know about it or they don't have someone that is directing them and coordinating all of their care. And value-based care, while a novel thought, just adds an additional layer of complexity to that, which gets to a point of navigation and how am I accessing and identifying that provider at the time that I need the care.
What else is holding us back? Is politics holding us back? Is money holding us back? Or is it really just the system itself that's holding us back as we kind of think about where we need to be in the future?
It's certainly a combination of all of those. I think there's a couple things that, rise to the top of the list. There has been, tremendous advancements from a technology perspective, but when those are introduced and they're doing great things in terms of treating, conditions that are highly complex, there's a significant layer of cost that comes into play with that. So I think that's a big issue that unfortunately, the healthcare system has not found a way to solve. There's certainly a political aspect of this. We don't yet know, with a new presidency and the changes that have taken place in both the Senate and the House, potentially what issues might be looked at, whether it's on the pharmacy side, whether it is on the provider side, whether it's on the healthcare system side, whatever it might be. That's still to be determined. But unfortunately, it's a combination of all of those that have not yet been able to solve this complex issue of how do we deal with the rising costs of healthcare. There's still a lot of work that needs to be done, both across the political ecosystem, but also on the supplier side in order to address that.
Let's kind of shift to the present. And Kevin Fyock, you already mentioned that Aon's 2025 health survey projects a 9.2% increase in medical and pharmacy costs.
Yeah.
About 80% of employers say that they're raising the required employee contribution to health insurance.
Yeah.
And that average contribution is going to increase about 6%, so up nearly a full point from 2024. So you've got all these recent survey findings. What strategies is Aon, are you guys out talking to clients and prospects about right now to help manage healthcare expenses?
It's not one solution, right? I think the first thing that we're trying to talk to our clients about is just raising this awareness of this high trend environment, right? And helping our clients understand what's behind this 9.2+%, trend factor. As Kevin Smith mentioned, chronic illness, especially around cancer, the impact of high cost claimants, the impact of pharma like GLP-1s and rising gene cell therapies, the prevalence of new technologies. So I think part of it is the awareness of the why behind these high trend numbers. And I think that's really important because then it helps us have a better conversation with our clients around, okay, based on all these factors of trend, what are the ones that are impacting your organization most? No two organizations are going to look identical, right? Most companies are impacted by an increase in high claims, an increase in chronic illness, and potential increase of things like GLP-1s if they're covered for weight loss. But shifting demographics, where you're located in the United States or globally, is going to have an impact on that trend number. Now, what you said, I think, is really important around the shifting to employees, the cost increase we're seeing to employees is something we've been somewhat insulated against for the past several years. When we came out of the pandemic, we saw a situation where employers were hyper-focused on attraction and retention of new talent. Extremely tight labor market, high inflationary environment from a CPI perspective, that's calmed down a little bit. And so I think we're having to rethink, when we all have this pie of healthcare to spend, how do we shrink the pie, whether it's steerage towards quality, as you mentioned, Kirk, or just finding, tactics to actually take cost out of the system, as opposing to have to shift costs, whether it's payroll contributions or at the point of care. It's going to be bespoke by every single client. But I think it is really interesting this year that we're starting to see a deeper gravitation towards cost shifting than we've seen in recent years.
2020, 2021, I was a consultant in my former life as well. We were having conversations with employers about the fact, hey, we've got to be reactive to employee needs right now. We've got to put in the childcare benefits that these employers are seeking as they're, stuck working from home in a remote environment. We obviously know that there was a mental health crisis in the country to begin with, which was just sort of exacerbated by the pandemic. And now we're in this situation where employers continue to see higher and higher cost increases every year. You've got some employers in the next couple of years that are going to have to make some really difficult decisions if they want to avoid potentially something as catastrophic as going bankrupt because of the liability that they've got from a healthcare expense perspective. How are you seeing that employers are kind of shifting the balance right now from maybe these empathetic well-being perks to really focusing on more foundational benefits as they're trying to address cost increases?
Yeah, it's a great point. Certainly, one of the biggest challenges employers are seeing as they look at the present and into the future is as healthcare costs keep rising, it is absorbing much more of their entire total rewards budget, which creates a major, major, major problem. As healthcare keeps absorbing much, much more of that, it becomes much harder to attract and retain that top talent. Going back over the last 5 or 7 years, employers started taking a look at a lot of solutions and strategies that were meant to address very specific issues within their healthcare programs, whether it was childcare, whether it was mental health, substance abuse, whether it was diabetes, women's health, or infertility. A lot of that was being looked at, and employers were investing in solutions to try to address that and assist their employees. We implemented many of these programs, and there were very specific reasons of why we did. But now, as we are dealing with this affordability issue, we are now taking a look and taking close measurement of these programs that we implemented. Are they working? Are we getting the results that we initially set out to achieve? Are our employees engaging in the programs, and are they seeing tangible results in the way that we expect it? And if they're not, do we need to then reevaluate? And to your point, do we need to look at allocating those dollars elsewhere within our entire healthcare and or total rewards budget? And using data and using AI is key to that evaluation, which is what we're seeing a lot of employers focus on. The other thing I'll mention is employers are still very committed to this idea of well-being. The most recent survey we looked at was 72% of employers are still offering some type of well-being incentive within their healthcare program. Now, it's expanded over the last few years, whereas in the past, it was mostly focused on physical. Now we've seen, that well-being expand into not just physical, but emotional, but work life, financial, social. So the well-being programs are still prevalent and employers still seem committed to them, but we are seeing employers take a closer look at what type of well-being programs make the most sense for our organization. Do we need to not just look at the physical? Do we need to look at some incentives, around things like lifestyle type benefits or lifestyle accounts, things like that?
I'm so glad Kevin brought up the total rewards equation because it's so important. And I think back to that example I gave of the pie we all have to work with from a healthcare perspective. There's also, to Kevin's point, a total rewards pie, right? So when you think about from an HR perspective, you have a portion of that pie that's dedicated to salaries, which is a good chunk of it, largely a majority. And then the other portion is the benefits contribution. But we're talking about a outpaced healthcare trend number. The compounding effect of healthcare is such that that pie is going to shift not just from cost to employees from an out-of-pocket perspective for healthcare, but the macro picture is that it starts to take away from the salary picture. So this becomes a pretty serious total rewards conversation. When you look at the trend factor 5 years out from a retirement perspective, a leave perspective, a salary perspective, and then a healthcare perspective, that bar from a healthcare perspective is 3 to 4x from a compounding point of view than all of the others. So the time is now to make these changes that are going to have a compounding effect. Otherwise, you're going to have a significant issue around, you only have so many dollars to spend from a salary perspective and a benefits perspective, and something's got to give.
The urgency is now. Like, the can has been kicked down the road over the last several decades. There's been cost shifting measures that, again, we're still sort of back to the same place that we are right now. And our company a couple of months ago put out an article that sort of likens the situation that we're in to back in 2008 when GM had its own crisis where their pension liabilities, their healthcare liabilities amounted to about 9% of their overall revenue. And that was the same time in 2008 when they had to take a government bailout. I think what we're seeing in the data right now from a forecast perspective is that by 2030, by 2031, a lot of employers are going to be hitting that same 9% threshold that GM hit, and ultimately, had to go out and take a bailout. And obviously that came with a number of other workforce strategies like reductions in force and so on and so forth. So we're sort of talking about this urgency, the time is now. We're talking about the fact that fragmentation is an issue. We're talking about the fact that, we see in our data that the average employer now has around 16 different vendors in their ecosystem, larger employers, more than 16. I'm curious, as you guys kind of think out to 2025 and beyond, are you seeing that employers are going to continue this concept of expanding into different solutions? Or do we think there's actually a situation where 2025 and beyond, based on how employers are measuring the value of these solutions that they have in place, so we're actually starting to see a consolidation of vendors in the ecosystem?
We saw coming out of the pandemic, the number of programs that were adopted was something like 30 to 40% increase in the number of programs. But as we started evaluating the effectiveness of those programs, a near majority of them don't even generate a positive ROI. Now, to Kevin's point, there was really good reasons as to why a lot of the employers put these programs in. From an engagement perspective, from the whole family and the whole member perspective. And some of them drove a VOI, not an ROI, and that's perfectly fine. Mm-hmm. But in this high trend environment, you need to ask yourself the question, like, are people using these programs and are they driving the ROI that they need? And I think it's up to an employer to decide what are those KPIs that you actually want to focus on from the programs that you have adopted. It doesn't have to mean that they're driving, a 10-to-1 ROI. It could be a break even or less than break even. You just have to define what is important about those programs. What we do know for sure, though, is the number one trigger we're hearing from our clients around why they are thinking about the consolidation or removal of certain programs is if employees aren't using them. And that makes a lot of sense, right? So you spent a lot of time and money implementing these programs. And if you have half a point utilization for something that you're expecting to have 10% utilization, well, maybe it's time to think about finding something else that either makes more sense or doing away with that program altogether. So I think that's like the criteria that we're finding stitching almost every employer together is this idea of engagement, who's involved in a program. And then secondary to that is, well, what are the savings that are generated from that program, be it ROI or savings, more qualitative, which would be sort of a value on investment.
And I imagine also just looking at redundancies of what all the different vendors that an employer is working with are now offering. I think the impetus for a lot of these condition-specific solutions, as an example, these were launched a number of years ago because the perception was that the health plans, that was not their core competency. Their core competency was managing networks and paying claims. And maybe they were short on the ability to support people with specific conditions. And that really led to this 2010s strategy and early 2020s strategy of expansion of point solutions to hone in on a specific type of condition. And I think through partnerships, through acquisitions, just through organic improvements with the health plan, maybe consolidation means, hey, maybe we actually take advantage of what the health plans are doing and kind of going back to the future at the same time too.
It's interesting in the healthcare world, it's on a cycle where, things always revert back to, what we think we've tried before. Whether it was flex benefits from years ago and cafeteria plans, and then we see that kind of start back up, and then HMOs. And now we're looking at this, more of a, focus back to, PCP directed care and virtual PCP models. One other thing I'll add in terms of where, we see employers, spending a lot of time and energy and focus. High cost claimants are becoming more of a challenge for employers in terms of controlling trends. High cost claimants have always been a big driver of trends, But now what employers are seeing is the costs associated with many of their high cost claimants are well beyond what they had seen in the past due to the high cost of some of the medications and just the advancement in treatments for certain conditions like cancer. So the other piece we're seeing, and I do see this as a really kind of big trend moving forward, is employers using, predictive analytics and AI in order to identify and put in strategies to help control the high cost claimants. And that can be just earlier detection. It can be earlier engagement. The technology exists today. It's a matter of making sure employers can understand it. They have the data that can evaluate it. And then they have the programs. Once those high cost claimants are identified earlier, they have the programs in place to help manage them more effectively than they've been able to do in the past. So I think that's going to be another major trend we see as we look forward over the next 12, 18, 24 months.
Yeah, I mean, I think with the sophistication of data warehouses these days and the use of AI, I think that's an incredible use case that you just brought up. Although I think I did just have to throw a quarter into the AI jar. I committed to not putting AI into any of the questions today, but kind of assumed that it was going to come up. So, but I think it is fascinating as we think about these multi-million-dollar claim scenarios and what ultimately employers can be doing to address these. So much of it has been retroactively in the past, but the way that we can kind of turn this around and make it proactive because of AI and advanced data warehouse technology is pretty incredible. So I've just got one more question. Just had a new administration put in place or re-put in place, I guess you could say, back in January. Mm-hmm. As you sort of think through the lens of policy ideas that are out there right now in 2025 and beyond, how do you anticipate healthcare policy changes are going to impact employer-sponsored healthcare program strategies in the short term and the long term?
First of all, your comment, Kurt, I wanted to go back to you throwing a quarter in the AI jar. I think we all know that AI and GLP-1s have to come up at some point every time we're talking about benefits. We've covered both of them, so that's perfect. So I appreciate the question, sort of the crystal ball question around sort of what healthcare policy are going to impact program strategies with this new administration. And this is very difficult for me to say as a consultant. I don't know. I don't know, and I don't think anybody knows. We've seen a flurry of executive actions from the administration, very few, obviously, on the healthcare side, but, they've been obviously polarizing. I think, to me, it's less about what's happening right now with this administration, more about the focus that employers have on this high trend environment. And these external factors, the economy, and the structural changes that we're seeing from healthcare more broadly that are thrusting employers into needing to make a decision of what they need to do. We do know that the reform we've seen on the healthcare side has been somewhat limited. It's been largely targeted on, very specific portions of the marketplace. Like we're all aware of the lawsuits related to fiduciary responsibility and the focus on the PBM industry. But we haven't seen broad sweeping regulations. And I think, Kirk, part of that is we're just now coming into the final confirmations for the Trump cabinet members. And so we might start to see more signaling in the coming weeks and months. But for now, I think we're just trying to focus on this high trend environment and how we can help support our clients based on all these external factors.
So I think a lot of it is, hey, stay tuned. I know there's going to be a lot more. I'm sure there'll be some additional opportunities for those listening to the podcast today to hear more about what is expected as more information comes available. So please be sure to check that out as well. So we'll kind of wrap it up here with kind of a fun segment around the future. If we brought the Aeon Kevins back in 2 or 3 years, what would the conversation be about? What big shifts do you see coming? How might employer healthcare strategies evolve in the near future? So let's kind of dive into what's next. So Kevin Smith, let's start with you. Give us one practical and one less conventional prediction on the future state of employer-sponsored plans.
I'll start with this. I do think we are going to see a continue of the trend of employers understanding that this bigger, broader healthcare network so that I can have as many doctors as possible available is not necessarily the answer, because we still have access problems. We still have health disparity problems. We still have affordability problems. If someone has access to a doctor, in theory, but they actually can't get to that doctor or they can't afford that doctor, then we haven't really solved the problem. So there is more of a focus right now of what is the right type of curated network that makes sense for our organization based on where our employees live, based on the way our employees engage and access in healthcare, and based on what our employees can afford. That is a trend that I think we are going to see continue. We're starting to see over the last year or so a slight movement towards it, but I think we're going to see more of a movement towards that. The other piece that I, again, have to mention from the quarter jar is employers are going to be doubling down on how can I embed AI into the management of my healthcare program, and not only the management and the measurement and the effectiveness of it, how can I utilize it to help me make the right decisions on how do we allocate dollars in the right way to our healthcare and benefits program in order to ensure that our total rewards program remains true to how the goals that we set as an organization. And AI, I think, will be a powerful driver in helping employers manage that. So those are the two that I would mention.
I'm curious which of those was practical and which of those was less conventional.
I'll let the audience make that determination.
I knew it.
Good question.
Sorry, I'm not the host, Kirk, but couldn't help myself. So maybe I'll first start with the practical, and at the risk of being redundant, I think Kevin's comment around sort of the future of the network, call it the future of the way we know health plans today. Part of the reason, we're in a situation of this trend that we find ourselves in is the ability for folks to access providers as wide as they want, wherever they want, without a focus on quality has had an impact. And so being better stewards to our members and steering them towards a better place to access care, I think is something that employers are going to double down with even more. From a less conventional perspective, I won't repeat what Kevin said around artificial intelligence. I definitely think that's going to continue to trend. Although what's interesting is when we survey our clients, a vast majority of them are relatively comfortable having these language models and emerging tools answer basic benefit questions. They're not comfortable with having it meddle in the sort of the delivery of care, in management of chronic illness. So I think there's a big disconnect between the impact these tools could have. We need to get more comfortable as a society, and leaders need to get more comfortable using it from a healthcare perspective. Candidly, the way that radiologists have used it for years and years and years, reading film from sort of like a detection of cancer perspective. But I think what I'm quite bullish on, and this is somewhat nuanced, the emergence of technology that isn't necessarily directly related to the delivery of benefits, but related to the management of healthcare conditions. So things like wearables. I think what I have on my wrist is a look into what we're going to see from far more productive wearables with things like clothing, glasses, gloves, shoes, so on and so forth, because I think we have tested out this thesis that distance care is absolutely a thing, and being able to manage conditions and work with the provider ecosystem from your home is very much a thing. But technology is starting to catch up such that we can do a much better job doing it than maybe we've done in the past. So that's a bit more science fiction. But if you imagine a world where people can be monitored at home and manage their conditions in a far more productive manner, that should theoretically bring costs down, bridging that gap between affordability and access and just improvement of care more broadly.
No, and I think what's awesome about what you guys have been sharing, both with present in terms of what your survey is showing and what you guys are talking to your clients about, as well as sort of your predictions for the future, is that these are broadly applicable, right? Like it's not specific to an industry, specific to a geography, specific to an employer size or funding arrangement, et cetera. Like I think fundamentally, every employer could use technology to ultimately drive improvements in trend, number one, improvements in affordability and accessibility for their employees and for their families, number two. If just philosophically employers are wanting to get people to better quality care, number three, I think all of the things that you guys have shared are really, really strong. approaches that an employer can take regardless of sort of what segmentation they are within the market. So any final thoughts or a call to action for our listeners?
Yeah, in 30 seconds, what I would say is the affordability crisis is real. The impact on the total rewards budget is real. It requires employers to take very innovative looks and approaches into how are we going to manage this moving forward. Technology, AI, predictive analytics, those are not blue sky 15 years out. I wonder if the healthcare system will ever get there. Those are readily available now. There are employers that are already taking a fresh look at them. There are employers that have implemented them. So I would encourage the employers listening to this podcast to take that evaluation and understand how technology, how AI, how predictive analytics today and next year and the year after can assist their organization, improving their benefits philosophy, managing their healthcare budget, a little bit better. It's a matter of being ready and willing to adapt change, and understanding how it fits within the parameters of their employer goals, and overall, their overall business challenges that they have.
I agree with everything Kevin said. I'll take somewhat of a different spin on it. And maybe this is a call to action. Maybe this is sort of a Pollyanna way to end the podcast. Years ago, I got a piece of advice from someone who was in academia. He's a physician. And what he told me was the innovation that happens from a healthcare perspective in the United States generally doesn't happen in academia. It generally doesn't happen in the political realm. It starts with employers and it starts with folks who are advising that landscape, because that's how a vast majority of Americans are covered from a healthcare perspective. So I take seriously the fact that change is going to happen from what employers choose to do over the next several years. In fact, I have a Post-it note on my computer that sort of reminds me every day that, like, innovation, while it's in my title, is core to what all of us should be doing and thinking every single day, whether it's putting in a program that's going to defray cost and improve the employee experience or steer people towards quality, or whether it's simply focusing on not that this is simple, but the affordability crisis and how do you protect those who are truly vulnerable. So my call to action, it's always been when I talk to clients I work with, is you are an innovator and you should think about how you can innovate within your own organization to improve the lives for the members that you work with. And maybe this is the Pollyanna side in me, Kirk, but the more that we can all continue the conversation together around things like what is the future of the health plan, I think the better off we'll all be.
Awesome stuff, guys. A huge thanks to Kevin Fyock. Huge thanks to Kevin Smith for sharing their insights today, and to all of you for tuning in. Stay tuned for more as we continue to navigate the future of healthcare. We'll catch you next time.
Thanks, Kirk.
If you're liking the conversation, be sure to subscribe so you don't miss future episodes. And if you've been enjoying Margin of Care, please leave us a review on Apple, Spotify, or wherever you listen. If you've got feedback or questions or something you'd like us to cover on the show, send us a note anytime at marginofcare@getgarner.com. We'd love to hear from you.